today. Americans aren't living as long as they used to. The CDC says life expectancy dropped again between 2016 and 2017. It is now 78.6 years. Researchers say there are two things really driving it: an increase in suicides and overdoses. The tri-state is ground zero for the opioid crisis. The CDC says Ohio has the second highest overdose rate, and Kentucky has the fifth highest. I am joined now by Dr. Larry Graham. He's the president of Mercy Health's Behavioral Health Services Department. I want to thank you for being here.
Thank you very much.
And with Kentucky and Ohio at the very center of all of this, why is that so concerning to you?
Yeah, it's really a travesty, the number of people who have lost their lives to suicides and to drug dependence, and largely they're preventable. And part of the problem, I think, is our access to care in Ohio and Kentucky, and really across the country, is really pretty abysmal in a lot of places. And so you only have about 10% of people who have active disease who are actively in treatment.
Why is that?
Well, I think there's a couple of hurdles that they have to face. First of all, I think as a society, we have to stop shaming people who have mental illness and who have chemical dependency.
Have we gotten any better with that?
You know, I think there's a lot of talk about stigma and bias, but I still have to confront it every single day. And if you're someone who's struggling with that and you have to walk up to someone you love and admit you have a problem, it's just a huge hurdle that they have to hop. And then even when you get to that point, and then access to care in terms of how many service providers are there. Mental health parity has been on the books for a number of years, but we really don't have mental health parity. And so their ability to get into the level of care that they need is really hindered.
Okay, so if we want to turn around the trend that we're seeing with life expectancy, what needs to happen in the mental health arena? I mean, how do you make it, how do you stigmatize it less? I mean, that seems almost like an impossible task.
Well, I think some of the things that help, for example, when celebrities come forward and they admit that they've struggled with their own illnesses, I can't overstate how important that is to people. I think the problem in part in the chemical dependency world is that we just don't have that icon, that celebrity who's willing to take that on, admit they've struggled with it, and be the face of the problem. That really increases awareness, and I think that's one thing. The second thing is we really have to push our legislators and the insurance companies, third-party payers. They really need to step forward and pay for these services. We know they save lives. We know it's imminently treatable, but they keep creating barriers to accessing the care. They won't pay for all of the medications that we might want to use. They won't pay for residential treatment when that's necessary. Those are things that can change very quickly.
So an overhaul in how we look at it and talk about it. Talk about it, talk about it, talk about it.
Absolutely.
All right, Dr. Graham, thank you so much for your insight.